Travel medicine is unique on a number of different ways. It is dynamic. So one of the reasons why the medical community is not that fond of travel medicine, because unlike diabetes or hypertension, where the guidelines may change once every few years, once a decade, right? For travel medicine, the recommendations could change daily. So sources of information and information gathering, information analysis, and then the application of the information, and ultimately what we call risk management strategies or risk mitigation strategies, are hugely important for pharmacists. So where do you get your information? Fortunately, there are some free sources and there are some paid sources. On the free side, we think about first understanding the environment you're going into. If you're like me, you probably weren't that great in geography, right? So Google Earth might become your friend, right? Google Earth is a great tool. It's free. Not only does it help you find out where Timbuktu is in Mali, but it also helps you understand what the terrain looks like. Is it, grass? Is it forested? Is it chaparral? What's the elevation? Are they going to be above 10,000 feet? All of these things you can find from this free application called Google. And it makes you sound like, not only you're going to have the knowledge because you've gone through training for travel medicine, not only you're going to have that knowledge, but you're going to fill in around that travel health consult with things about, well, when you're flying into Cusco and then you're going to take a train down, for example, and you're going to go to Machu Picchu to see the ruins, and then you'll be back. And well, Machu Picchu is only at 8,000 feet, so you're going to feel better as you start to go down. They're going to wonder, wow, when were you there? And I always like to reply, I've never been there before. If you can build that so real for them, they'll start trusting all the other recommendations you have. Because now you sound like a trusted friend who's been there before. And you can do that virtually. That's why travel medicine is sort of like being an armchair quarterback, right? You get to play, but you never have to leave the armchair because you have all the resources at your fingertips. Now, to get that information side, the authoritative source for travel medicine recommendations would be the CDC. And the CDC publishes what's called the Yellow Book, which has all different recommendations. Their online site, again, all free to use, is updated more frequently. Now, for printed recommendations, the CDC has gotten better at their tool. They have one for health professional side and one for the traveler side, where people can go in and look up. They have little modifications. You can check a box if you're pregnant, if you're a child, right? So that you can modify or at least give some extra recommendations in the vaccines or medications or counseling points that are relevant to that population. It's gotten better. One of the main downsides, though, is that the CDC travel site only allows you to do one country at a time. And it's really not formatted for printing. It's really designed for online viewing, but we know that people still like to have print documents right now, at least depending on the generation you're talking to. In the future, it'll all be electronic because people will just be looking at their iPad or Android phone or whatever to take their travel information. But right now, printed recommendations are still very effective. So the CDC doesn't format it very well, and it only allows you to do one country at a time. Now there are commercial sources. So commercial sources for travel medicine use multiple different sources, where the CDC can only rely on their own information because they have an internal body that vets and puts the information within their recommendations. The commercial sources can use Canada, UK, Australia, other places throughout the world to pull in different recommendations and different epidemiology from the various places around the globe, and then vet it through some travel medicine professionals who are physicians who specialize in this, and then put it into a format where it prints out well. The software allows integration so that multiple countries can be put into one report. Because it turns out when people go to Southeast Asia, for example, they're not going to go just to Thailand. Oftentimes they're going to Thailand, they'll go to Cambodia, they might go to Vietnam. So putting in all these different itineraries. Someone who's on a cruise ship is going to hit multiple ports of call. So having multiple itineraries is an important aspect to travel medicine. The commercial, the paid sources do a bit better job at that. The three major sources that people look at are Travax, TravelCare, and Tropomed. Those are probably the three most common in the United States that I've seen that people use in a travel clinic. I think as a travel medicine provider, if you're serious about doing this, you need to have whether you're using the commercial source, the CDC's Yellow Book consistently, or you're using a commercial source, you need to use one of those consistently so that you are always current and you're always providing the most authoritative information for people.